Acetaminophen is an analgesic and an antipyretic. It is associated with Stevens-Johnson syndrome and has a toxic epidural necrolysis. And you need to caution with patients with high alcohol use, undernourished, or that have liver disease. It can blunt the immune response in childhood vaccine. Liver damage can occur at 4,000 milligrams per day. And the signs you want to watch for with an acetaminophen toxicity is you're going to watch for nausea and vomiting, diarrhea, sweating, and abdominal discomfort. The antidote for this is acetylcysteine. The side effects, blood pressure. If you're taking it a long time, your blood pressure is going to go up, so you need to monitor that. If you're in a high-risk group, you need to limit it to about 2,000 milligrams a day because it can. And if you're taking warfarin, know you're increasing your risk of bleeding. Monitor your high blood pressure, and if you start that rash, make sure you're seeking medical attention. Okay, the next one is going to be... Okay, so an aspirin, it's an analgesic, an antipyretic, and an antiplatelet. It also suppresses inflammation. It is a type of NSAID. Now, here's the cautions with aspirin. If you take it short term, you're probably going to be pretty safe, but it can cause GI hemorrhage. It should never be given to children because of the Reyes syndrome, especially if they have the flu or with chicken pox, and pregnant women shouldn't take it because it does thin your blood. You need to caution giving it to older patients who smoke, patients with peptic ulcers, bleeding disorders, or hypersensitivity to aspirin or to NSAID. You want to take it with food or milk or 8 ounces of water and avoid alcohol to decrease the GI effects. It can be toxic, and it's a common cause of poisoning, and if you take too much, it's not reversible. There's not anything you can take. They just treat the symptoms. The lethal dose is 20 to 25 milligrams and 4 milligrams in children. It can also cause heartburn. If you're going to take this for a long time, you want to go ahead and take your protein pump inhibitor to try to protect your stomach, and you want to discontinue aspirin use before surgery. You're going to watch for ringing in your ears, sweating, and headache. Dizziness is all signs that you're having a reaction to the toxicity, and make sure that you know the bleeding risk with this medication. Okay, ibuprofen. It's an analgesic, an anti-inflammatory, and an antipyretic. It is in the NSAID family, and it's used to treat mild to moderate pain. You do need to watch out. It is a risk for having a myocardial infarction or a stroke. If you're undergoing chemotherapy, you're going to have a higher risk of bruising and bleeding. Don't ever take more than 3,200 milligrams. You got to watch for thrombotic events, GI bleeding, ulceration, and perforation. If you take it with food, it's less likely to upset your stomach. It also can cause Stevens-Johnson's and hepatitis, and you do not want to take alcohol while you're taking it. Okay, here's your story on ibuprofen. Remember, it's going to take pain away, it's anti-inflammatory, and it's going to take your fever down. Patients can take it directed for pain, fever, and inflammatory properties. While on this medication, patients should monitor their GI bleeding. Look for black tarry stools or coffee ground emesis. The medicine can cause Stevens-Johnson syndrome and hepatitis. It should not be taken with alcohol. There is a risk for an MI and stroke. And don't take more than 32 ounces a day. Eat with food if it upsets your stomach. Okay, Ketorolac. Ketorolac is it's a very powerful painkiller. It's equal to morphine or other opioids. It has a small amount of anti-inflammatory properties. It manages acute pain, but usually you're going to see it used for post-op pain. You can only take it for 5 days. Usually they're going to give it to you in an IV, and you're going to see those reactions You're going to see those reactions you're going to feel the effects in about 30 minutes is when it's going to peak, but it persists You're going to see it in about 30 minutes. It peaks in 1 to 2 hours, but it persists for 4 to 6. It's eliminated through your liver and your urinary excretion. Don't take it with other NSAIDs. You could get peptic ulcers, GI bleeding, prolonged bleeding times, renal impairment, suppression of uterine contractions. It can cause Stevens-Johnson. Here's your story on ketorolac. Patient is suffering from chronic pain or just came in out of surgery. Ketorolac is prescribed as one injection and then continued for 5 days at home. Don't take with other NSAIDs and because of the risk of GI bleeding. You want to monitor for rashes in case you're getting the Stevens-Johnson syndrome. Okay, now we're to our bronchial dilators. And the most common one you're going to see is albuterol. Albuterol can be given in an inhaler or as through the nebulizer. It's used to treat asthma. It opens up those airways. It relaxes the bronchial muscles and to help you breathe better. Beta blockers do the exact opposite, so be careful if you're given both. You're counteracting your medication. You're monitoring for chest pains, palpitations, because it is going to increase your heart rate and give you tachycardia. You're going to monitor for an aspirin toxicity, the same thing. You're going to look for tinnitus. You're going to look for headaches and dizziness, tachypnea, and diaphoresis. So what you're going to say, you want to make sure that, so here's your story on albuterol. A patient suffering from asthma and COPD. This medication dilates the bronchial passageways and makes breathing easier. The medication increases heart rate and may make the patient feel jittery or nervous. Make sure you're rinsing your mouth after using the medicine to keep you from getting sores or thrush. Patients should avoid caffeine.